You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Melissa, welcome to The Health of Business. I am so excited to jump in because we've recently connected and have just really gotten to know each other. And I think what you're doing is so fantastic and needed in the area of Penticton where you are and just in the world in general. So if you could take a moment and introduce yourself, let our listeners know, who is Melissa Thompson and what does she do?
Well, thanks for having me on the podcast, Danielle. I'm really excited for this opportunity. And I'll talk about what I'm doing. So I'm Melissa Thompson. I'm a physiotherapist in Penticton. I own Living Grow Physio, which I started. Actually, the business name was April of 2025, and I saw my first client June of 2025. So we're still officially in the first year. And Living Grow Physio does in-home physiotherapy for the South Okanagan. So my catchment area is from Penticton to Osoyoos. And we might talk about it later, but the business license is interdisciplinary. So I actually get to do that area with one business license, which is very cool.
So good. Yeah.
And then what we'll really probably dive into is myofunctional therapy, which some people probably don't know what that is. So I'm really excited to tell people about that.
Yeah, I can't wait. It's we've chatted a little bit off script about it, but yeah, I'm really excited and to learn how you've kind of integrated into your business. So, I we were talking about this earlier as well. You have 2 young kids at home and you started your business during your mat leave. Is that correct? Tell me about that and that decision and how you were able to juggle all of that.
Well, let me ask your husband, maybe I didn't juggle it, but I have 2 kids, so they're almost 2 and 4. So on the last maternity leave with our youngest, I guess I should probably step back. So previously I was working for the public health system in community rehab. So I was just doing home visits at that time. And in my 3rd trimester of pregnancy with Casey, my youngest, I actually got cornered in a bathroom with a client. And they became aggressive and started hitting their walker against the side of the wall, and they started coming towards me.
Oh my goodness.
And it was kind of it was definitely scary. I remember being like, "What am I going to do if I jump in the bathtub? Will they maybe not be able to hit me? What am I going to do?" I'm definitely cornered. I was very fortunate that I was able to talk the client down. And they exited the bathroom. I was able to grab my belongings and leave. So I was safe. Nothing happened to me. But no matter what, it's scary happening. And then carrying your baby and you're like, is something going to happen to them? It was, anyways. So long story short, there was a work safe plan. And with that, and I had an awesome counselor that I talked to and worked through a bunch of things and just realized where in life I was and what I needed and what I wanted was essentially what it came down to. So I've always wanted to be a business owner. I think it's always kind of been there, and I'm not sure how I wanted that to be. So I know my parents are actually farmers. I grew up on a dairy farm in Alberta, so I've always had that business mindset. Obviously, healthcare is quite different, but so knowing I wanted to start a business, doing some reflection on maternity leave after that incident and realizing life's kind of busy. We have 2 kids. We know that daycare is hard to get into. And then kids get sick and they can't go to daycare. And if you're working Monday to Friday, 8 to 5 or those scheduled hours, it's really hard, right? You wake up, oh, the kid's sick. What are we going to do? So just needing more flexibility in my life was really what it came down to, and having a schedule where I could spend more time with my kids. So that's what it came down to. And on maternity leave, I took the leap and did all the research. And I want to actually give a shout out to your business of physio, which is now out there. I wish it was there when I started because I was like, I have no idea what I'm doing. I'm just doing a lot of Googling and researching and okay, yeah, I think I've got everything. So anybody thinking about starting a business, reach out to business of physio
Oh,
because that
thank
will
you.
definitely direct you in the right place.
Thank you. Honestly, it's a joy. It's a joy. Like I love doing it. So I'm glad it's been of support to you. So that's what a wild story. I did not know that. And then what a gift to have had like such an incredible counselor like really help you see where you wanted to go with this. How so okay, so you started it, name was a year ago. How has that looked over the last year? Like, what's that transition looked like for you? Because obviously flexibility and time with children is like, paramount in this, in this setup for you. You're still doing mobile visits. So I have questions around like safety and all of that component too, and how you've integrated that. But yeah, tell me a bit about like the leap and what that's looked like now over the last year as you've built it.
Yeah, so ironically enough, or maybe not, I was at a baby seniors outing at a long-term care facility with my daughter. It was been around June maybe, and the world of physio is not that big, right? You meet physios, you want to connect you. So the physio that was working, we exchanged contact information. And I'm like, oh, like, yeah, I'm starting my own business. If you ever need coverage, like, I'd be interested. Anyways, left the conversation, heard back from her, and she said, hey, are you actually interested in taking this position, this subcontract, and leading the position? And I went, what? Like, this is amazing. It was July when she reached out. And I was like, okay, so if I take the subcontract, I don't have to worry about how I'm going to pay my bills. I don't have to worry about picking up casual at the public system, like, because I wasn't really sure what I was going to do, to be honest. I
Yeah.
was kind of just rolling with it, which my husband's a lot better at doing than me. He's like, don't worry, we'll figure it out. We'll roll with it. Where I'm very much like, okay, I want to plan, I want to schedule, you know,
Yeah.
Anyways, I took the position with the long-term care facility, and that was great. So that took the pressure out financially while I
That's
was going to
huge.
build my practice. And then reaching out to doctors' offices, local practitioners, so like acupuncture, massage therapists, other physio clinics. And I actually branded my vehicle. So my vehicle
Cool.
says Living Grow Physio on it.
Yeah.
And that was actually one of the way I've got a few clients just driving around. It says in-home physiotherapy on it. People have my website, my phone number, they can reach out. And yeah, it's
Amazing.
actually one client, because I always like to keep track. Like, well, how did you hear about me being a new business owner? Like, where am I putting my marketing? Where should I redirect marketing? And one client said, I don't know if you want to know. I was like, well, now I definitely want to know.
Of
He's
course.
like, um, so I might have followed you for a while. I was like, "Oh, okay. Like, are
Oh
you
my
gonna
god.
tell me I was a bad driver? Like, where are we going with this? Did I cut you off or something?" But no, they waited until I parked and then took a picture of my vehicle
Oh
and
my
then
gosh.
found me on Google. So
That's hilarious. Oh my goodness.
yeah,
So I guess if anyone's following you, it's likely because they're trying to like get the information. Hopefully.
that's what I'm gonna tell myself. Yeah, or
Yeah.
they're gonna call me and be like, "This employee was a terrible driver,"
You're like,
and
that's
hopefully
fine
they
because
don't
I'm
look on
the
the
owner.
website.
So
Yeah, or I'm gonna if they don't look on the website, I could play it off as an employee maybe.
yeah, exactly. You're like, oh yeah, no, that must have been one of my staff. That wasn't me who ran that red light.
Or maybe my kids are screaming at me the whole time.
That also. That's such a unique idea, right? Like it's so funny how underrated sometimes those things are. Like and I know, like we've had conversations like just in class and in other, areas about marketing and how to reach people. And I think so many people get so focused on like social media and like, really like it sounds to me like what you've done from a marketing perspective is like high ROI. Like the vehicle piece is like such a simple thing and yet so many people don't do it. Like we're driving around anyway. Why not put a phone number or QR code on your vehicle? Like, why not have that there? And then to reach out to doctors' offices and people who are like, everything is referral based. Like, so much of our business is referral based, having those connections. And so that's really probably been like the highest ROI for you. And then obviously knowing where your ideal client like lives within those different types of doctors or specialists or whatever is like huge. Like you've done some pretty like simple and yet effective marketing. Like how do you feel like it's been high ROI on those things?
Yeah, like the two. with my vehicle. And then the second was doctor's offices in
Yeah.
Penticton,
Yeah.
in particular. Just people call them and say, I can't get out of my house. Do you know anyone that can come and do in-home physio? And building those relationships with those clinics. And yeah, I've got a ton of referrals from them, and I'm very appreciative for that.
That's awesome. Yeah, and I think that probably brought in way more clients than, like, having spent like, for people who are spending so much time building out social media, like and also, like, you're working with people who are homebound, who are maybe, like, elderly. If you're working at a long-term care facility, like, those people don't really necessarily live on Instagram or TikTok anyway.
And, well, the other reason, so I guess maybe I should backtrack as well. So I didn't talk about my degree at all when I did my intro. I just realized, but I maybe let's touch on that quickly.
Mhm.
So my undergrad I actually did in Billings, Montana,
No
and that
way.
seems like a unique place. Yeah, so I was fortunate enough to go on a golf scholarship.
Cool.
So yeah, I always wanted to, you know, to look like a student athlete, and I was fortunate enough to go on a golf scholarship. Everyone says, "Why didn't you go to California, Phoenix, whatever?" But I was 18 years old, first time ever leaving mom and dad, and at least it was like I think it was like about a 12-hour drive.
Oh,
Anyways,
yeah.
so I went there, made friends, fell in love with the place, never left for my degree. Then I came back and I was working as a recreational therapist, occupational therapist at the hospital in Alberta. And during that time, I was applying to physio schools and I would get an interview. I applied to like University of Toronto, University of Alberta, University of British Columbia, and I
Yeah.
never got accepted. And I was thinking, okay, maybe I'm not meant to be a physio. Maybe this isn't the right path. Really felt the passion. Like I was in grade 11 and I tore my ACL playing basketball. So that's when I got introduced to physio, just like 90% of physios, right? We have an injury. And
Also tore my
it just
ACL at
felt right.
17.
Yeah. Yeah. It just felt right. It just, so,
Mhm.
anyways, I always wanted to travel to Australia. And I just threw my name in for a couple schools in Australia and I got accepted right away. Like, it was awesome. And
Amazing.
me and my now husband, we moved to Australia. We moved to Gold Coast in Queensland, Australia.
Amazing. Did you go to Bond?
I did actually. Yeah.
Yeah, okay. Oh, so good.
Do you know somebody that was Bond?
Yeah, I've heard of physios going there, but I did an undergrad exchange at UQ in Brisbane. So there was like I knew of it and I knew that it had a physio program that a lot of Canadians went to at that time. But yeah, I've heard it's incredible. And to live on the Gold Coast in Australia.
Yeah. Yeah. So that's where I did my undergrad or my physio degree. And
Yeah,
then after in my last year, my last placement was actually community physio.
got it.
And I fell in love with it, going to do home visits. They have long-term care in it as well.
Mhm.
And I was fortunate that they hired me on. So it actually worked in Australia in community rehab or whatever you want to call it
So good.
for a company called Allied Connect, actually. So,
Huh.
and I was working on it and everything was going great. And then it was 2020. I'm pretty sure everyone knows where this story is going. It was March of 2020, and we flew back to write my Canadian physio exam. And then we are going to go back, work for 6 weeks. We had an Airbnb close to the beach. Like, we are just going to, enjoy it for the last little bit.
Yes.
And as we were flying across, the ocean was when all the sports shut down. So I remember we were leaving, and my husband's like, "Oh, we should probably bring our golf clubs because we're both big golfers."
Yeah.
And I'm like, "It's March in Alberta. We're not going to be able to play golf. Like, that's ridiculous." It's like, "Well, this pandemic thing. What if we can't come back?" And I'm like, "That is ridiculous. We're going to come back. Like, you need to just relax. Like, you're the one that just goes with the flow. Like, why are you so worried about this?"
Yeah.
And long story short, we obviously got stuck in Canada. We couldn't
Yes.
go back. We were looking at wedding venues in Kamloops, and I remember we went to the airport to just try and get on a flight to go back to Australia. So we had an apartment full of belongings, like
Yeah.
everything was there, and of course we couldn't get back. So
Oh my goodness. So when did you eventually like get back? Like when did you like because I assume you had to go and collect all your things. Like how did that work
no,
out?
actually, we've never been back. So
What did you do with all your
we
stuff?
we had to get friends to get a key to go into our apartment and pack up our belongings.
Oh my
Yeah, it was wild.
goodness.
And at the time change, I remember whenever I think we've gone through like life's crazy, I always think back to this time where we were calling like people in Australia at like 2 in the morning Alberta time and just like the time difference it was crazy. And I
Yeah.
remember calling my boss at like Connect saying like, I'm gonna have to resign from my position. He's like, let's just see. And I'm like, literally can't get in the country. Like,
Yeah, like
so yeah, so I had to resign from that position because of the pandemic. So
oh my goodness. Wow. That's like, you hear stories like that, like, how disruptive, like, because you came home literally just to write the exam, like, it was supposed to be, I assume, a short period of time.
we're only supposed to be home for 2 weeks. And I was fortunate. I wrote my exam in Calgary and it was the written. So I wrote the
Yeah.
written in
Oh, thank
Calgary,
goodness.
and the
Yeah.
next day was supposed to be in Vancouver, and the Vancouver one got canceled.
That's right. So you literally were, like, the last cohort to write that exam before, because like, they didn't certify someone in Canada for, like, 2 or 3 years after that because they couldn't get the exam together because of
Yeah.
COVID.
So yeah, so I got that done, and then we never got back. And we finally all of our belongings from Australia got shipped to Vancouver in September that year. So like what, 5 months later?
Oh my goodness.
Yeah.
Wow. What a process. That's quite the story. But I guess, okay, so you were saying you were working in community there and fell in love with it. So that was like part of your intro to it back in Canada, I guess.
Yeah, so I had the placement and the job, and I was just like, "This is so cool," like, to be able to help people in their homes out, like, seniors it was typically seniors that were
Mhm.
struggling, like, "I had a shoulder injury, I can't reach for my glasses," or whatever it might be, like, let's problem solve so you can do that,
Yeah.
but then also make an exercise program to give you that independence back, and that's
Yeah.
really what built me up inside, is really giving people their independence back. If
Yeah.
like, if you can't do things for yourself, then it can't keep you at home, and we already know our healthcare system is overflowing. So let's
Yeah.
try to keep people moving as and independent as long as we can.
Oh, that's so cool. And like, it's so rewarding when it's functional like that, right? When that lady with the shoulder injury can't reach the oil to cook her meal, that's so limiting, right? But then give her that back and now she can eat and nourish herself, and like the dividends that that pays are not just like pain relief, it's like independence. It's so rewarding. I can imagine. So did you when you I mean, obviously this is like March 2020, you write your exam, eventually you get your license. What did work look like at that time?
So in March of 2020, I left that position. I was actually living back with my mom and dad for was it like 12 weeks, I think? I was applying for jobs to Alberta because we were planning to
Were
go
you working on the
work
farm at
in
that time
Alberta.
too?
Yeah, I was.
Amazing.
Yeah, it was anyways, so it's a grain farm now. It's not a dairy farm anymore.
Oh, okay, okay, but you're still,
Anyways,
like, working on the farm.
yeah, I was helping out around the farm, and so I'm applying to, like, all these Alberta Health Services positions, and I'm like, "I don't think I'm that bad of a candidate," but, like, not getting back, and I'm like, "Okay." And me and my husband, he was actually born in Penticton, but all of
Oh,
his family's moved away, but we always wanted to come back to the Okanagan, and I actually applied for a job at Kamloops Hospital and Penticton's Hospital,
no way.
and I heard back for like a week. It was like Penticton was like really quick, and I think maybe like interview on a Monday, got offered the job on a Friday or something like that.
Amazing. Yeah.
So yeah, made the move. We moved to Penticton in June of 2020,
Wow.
and then yeah, I worked in the hospital there for the first bit. So and then of course I was working for like 2 months and found out that Alberta Health Services had a hiring freeze. That's why I never heard back. So I was getting these calls for like, "Hey, do you want to schedule your interview?" And I'm like, "Well, no, actually, I've
I've
been working for a while, but would have been nice for you guys to post that."
Yeah, that would've been nice if that was like, at least I know why I wasn't hearing from anyone. Yeah, got it, okay. But in the
Mhm.
end, you ended up in Penticton, which it sounds like you're happy there, right? Like, maybe that was serendipitous in a way.
Oh, for sure. Like I remember thinking, okay, so you want to move to Okanagan? Like everybody does, don't they? I know people listening to this like, ah, no, Vancouver's the best or wherever they're at, but we, yeah, we thought people are going to come here to retire. It was going to be really hard to get a job. If you want to work as a physio, Penticton has lots of openings though. So
Yeah.
I'll do a plug, but yeah. So we got the job and you're found. Yeah, it was really exciting.
Amazing. So was it a community job or was it a in-hospital job?
In hospital. So I worked in the hospital until 2022 when I went on maternity leave with my first daughter.
Right. Yeah.
And then during maternity leave, a posting came up for community. So I actually switched over to community while I was on maternity leave, I guess. Like after that maternity
Yeah.
leave, I came back into community.
Yeah, yeah. Oh my gosh. Okay, so then that kind of started the whole trajectory of working in community, and then now where you are with Live and Grow, working independently, doing mobile work for yourself. So, oh my gosh, what a full circle journey with like just a little hiccup with COVID in the middle.
Just a little.
Just a little. So, okay, so tell me a bit more about the business now. Let's really dive into, like what have because a lot of people go out and start like solo practices, right? Like I did the same thing. I did a solo practice. Like it's really, I think, transitioning from, well, and in your case, you went from public to business owner. Like there wasn't even working as a contractor in a private system. Like you didn't really even have that experience, it sounds like. So you jumped right from like public to building a business. That's quite a jump because many people have that like contractor or work in a private setting, kind of intermediary. So what did you find were like the biggest things or like learning curves that you had to deal with in starting your business? Yeah. Like what were the biggest learning points for you?
I guess first step was like starting the business, like learning the process, learning about business licenses, all of that. Um, I've got a funny story about my business license.
Yes, please explain.
Okay. Um, so my office is in my house because I go out and do home visits in clients' homes, and then my clients or my functional therapy clients come to my space. So my office is in my house, and my business address, and you have to for the city of Penticton, you have to like have a drawing of your house, and you have to scale it and everything. And I'm like looking at a floor plan, cannot figure this out. I'm I'm like, "How am I gonna scale this? How am I gonna get this on a piece of paper?" And maybe I was a little sleepy bad because I had the little one at home, but I started taping pieces of paper together and I'm just gonna trace it. My husband walks in and he's like, "What are you doing?" I'm like, "I don't know, I'm just gonna have to, like, trace it, I guess." He's like, "No, like, give me that." And thankfully, he, scaled it, so the city of Penticton didn't need to have, like, 10 pieces of, like, paper me walking in with my business license information, but
Oh my
yeah,
goodness.
he was like, "Needless to say, being a business owner, sometimes you have to lean on other people."
Yeah, great. Yes, exactly, right? And like but also like sometimes you have to like trial and error and figure it out. I'm sure we all have plenty of those like clunky stories where like I don't know what this means, so I'm just going to like do it the way my brain imagines doing it. Like we all have those zigzags where you're like I got to figure this out.
Oh, I know, I was
So,
like, "Scaling? Like, what? Do you want me to, like, make it smaller and, like, map?" And I was like, "I don't know, I just can't do this."
oh my god, that's amazing. So yeah, okay, so you get the license, and so now your business, you said, so you go and do the home visits or go to the long-term care facility, and then people come to your home office for the myofunctional therapy.
Yeah,
Got it. Okay, so it's kind of like a hybrid there. So so you go to people's homes, that's more so those are more your like elderly homebound type clients. And then who comes to you for myofunctional therapy? Let's talk about that a little bit.
yeah, so, yeah, the reason I for home physio, it's typically the elderly, people with neurological conditions, people that really struggle to get out of the home.
Mm.
So when I was working in the public system, I noticed that we have lots of people that going to the clinic is exhausting and they get there and
Mhm.
then to do rehab, they just cannot. Or it's in their home, like they need to practice transfers in their home. As much as you
Yeah.
try to mimic that in a clinic, it's just hard. One, you don't know what it looks like. Or even if you get a picture, like just the handholds and everything. So my private clients are those people that can't get out of their home.
Mhm. Mhm.
Yeah,
Yeah.
so especially and then myofunctional therapy is new, and those people are typically able to do the stairs to get up to my office.
Yeah.
So because it's above my grasp. So those are the people, obviously, if they couldn't, then I would do a home visit for that. But
Totally.
malfunctional therapy, typically right now, because it's growing and it's a new area, the people coming to see me are going to get a tongue tie release
Oh,
or they're getting orthodontics, so like Invisalign or something, or they've had it before and it's relapsed.
got it. Okay. So what is it? Yeah, let's dive into it because I'm so curious and fascinated about this. Like what is the approach? What is myofunctional therapy?
So myofunctional therapy has 4 goals. So it's talking about breathing through your nose. So you should be breathing through your nose all day and night. The only like you shouldn't never be breathing through your mouth, which if anybody listens to this podcast, they're probably going to be analyzing everyone. So physios were always analyzing gait. Now everyone's going to be looking at everyone's mouth and figuring out what's going on.
And they're breathing.
Um, the other thing is our lips should actually be closed unless we're eating, drinking, or talking.
Right.
So yeah, we shouldn't have our mouth open. If our mouth's open, we're probably breathing through our mouth. I guess I should put smiling in there, right? You can
Right.
smile with
Yeah.
your mouth open, but the
Ah, that's
third, the
wild.
third,
Yeah.
yeah, the third concept is tongue posture. So I'm actually going to encourage everybody that's listening right now to just check in with their body and see where their tongue is positioned in their mouth. What do you think,
Mine
Danielle?
Yeah, mine's kinda neutral. It's not on the roof, it's not on the bottom, it's kinda neutral. The tip is touching the back of my upper teeth. Yeah, it feels I've never really had to think about it. It feels kinda neutral, like, I'm
Right?
not pressed up, I'm not pressed down, but it's, like, touching the back of my teeth.
Just kind of floating, maybe. Would that
Yeah,
be correct?
yeah.
Yeah. So some people might notice that their tongue is in the bottom of their jaw, like the floor of their mouth. Some people
Mm,
might be floating, but what we actually want to accomplish is the tongue up in the roof of the palate. So your
mm,
tongue should be suctioned, and you actually, when you get at this enough, you don't have to work to keep it there. Like there's research out there that it makes a suction and it just stays there.
whoa. I'm definitely not suctioned.
And honestly, neither was I. So before I found Myo, I was definitely tongue in the bottom of my mouth, and I thought that was wrong. And people told me
Wow.
this, I'm like, that's not a thing. And then obviously, as I learned more about it, our tongue is actually a natural pellet expander. So
Mhm.
we actually want wide faces. We don't want long, skinny faces. Long,
Mm.
skinny faces are actually part of mouth breathing, like a sign of it. And
Whoa.
then with mouth, this is kind of interesting. Because we're struggling to breathe, we naturally bring our chin forward and kind of get that
Mm.
head forward position because that opens our airway. So
Whoa.
it all comes back to our posture and our whole body.
Wow.
And then the
That
fourth
tongue
part that we
position.
touched on,
Yeah,
yeah.
yeah.
And then the fourth part we touch on is swallowing habits. So obviously we're not SLPs or OTs that are functionally looking at swallow. It's just the mechanics. Your tongue should be behind your teeth. It's called the spot in myofunctional therapy.
Mm.
And your tongue should be doing like a roll to swallow. You should be using your cheeks. Yeah, it should just
Whoa.
be a nice natural movement.
These things that we, like, don't like, breathing, swallowing, like, these things are not something we're, like, there's such, like, autonomous or autonomic actions that we're not even thinking about it and yet have such a huge influence. How did you discover this? Like, how did you get into it? What made you want to explore this as a niche within your business?
So yeah, I didn't even know it existed until September of 2024. So my daughter was born in July of 2024, my youngest, and she was having trouble nursing. And I was really struggling with it. Kind of heard about tongue ties, had a couple of friends that had their kids have tongue tie releases. That was all I knew. And I got referred to Dr. Pata. She's in Kelowna. She's the dentist with Collaborative Care in Kelowna. So
Mm,
we go there, and Casey got her tongue and lip ties released,
mm.
and that helps. So she had a tongue tie, so her tongue actually couldn't elevate. It was just stuck on the floor of her mouth. So there was no way she was ever going to get her tongue up to the palate because she was restricted. There was tissue that was restricting her.
Got it. Got it. So this
So
was your
with
first exposure to
Casey,
it.
that was my first exposure, and yeah, we had the releases, and that was great. And when I was at Dr. Pata's clinic, she had some information on the walls and like, oh, I have that symptom. Oh, I do that. Oh yeah, I have neck pain all the time, jaw pain all the time. Oh, I can sleep like 10 hours and still be exhausted. I have bags under my eyes. I wake up with a dry mouth. What else? Trying to think. Like it feels like I feel like a new person now. I don't have any of those symptoms, but looking there, so then yeah, I got an assessment and I had a tongue tie as well and a lip tie. And it's quite common that they are hereditary. So if you have one
Right.
and your kids usually have one. And actually what happens is kids usually have trouble with eating or nursing. And that's how they get diagnosed. And then typically the parents are there like I was. And then they get diagnosed. So
Oh my gosh, that's so funny. Yeah, it's like she has it and she got it from you.
yeah, like there's genetics. They're still trying to figure out exactly. There's a lot of growing information about why and how it happens. But essentially, if you think about people that have webbed feet or webbed hands,
Yeah,
that tissue was supposed to be reabsorbed in
right.
utero, right? So you weren't supposed to
Yeah.
have a lot of webbed fingers. And the tongue tie, it was supposed to be reabsorbed as well, but it wasn't. We don't really know
Mm.
why, but we know that it didn't get reabsorbed.
Yeah, yeah, got it. So yeah, it's like a webbed tongue or a webbed lip, like with that little frenulum piece underneath.
Hmm. Yeah.
Interesting. Okay, so in myofunctional therapy, then you're doing exercises, manual therapy to maintain the release or to prep for release. What does that look like?
Yeah. So before you have a release, it's recommended that you do myofunctional therapy to dissociate. So lots of people move their tongue and move their jaw. So you want your tongue to move independent of your jaw.
Oh,
As you're
I'm
doing the
like,
faces at me, I'm just a little
you can see.
distracted.
I'm feeling all of this
Yeah. So,
inside, thinking I need an assessment.
well, come see me.
Yes, I'm going to.
Yeah. So you want to prepare and you want to like loosen those tissues, and part of that therapy is learning how to move your tongue. So even if you are restricted, practicing and getting your tongue up, doing clicks, doing exercises to move that tongue. Most people don't really put any attention to their tongue. Kind of, okay, whatever, right? It's there, but we don't even know where it's positioned. So thinking about where it's positioned, getting ready for a tongue release. And there's actually research to show that doing myofunctional therapy will improve the release technique. So if the tissue
Wow.
has actually had time to soften and get relaxed when the release happens, it's easier for the practitioners to do the release, and there's usually better outcomes.
Oh,
Obviously,
that's
it is
so
surgery, like
interesting.
there can be complications,
Yeah.
but it does show that the tissue is softer. So when I had my release, actually, I did myofunctional therapy before with a different practitioner, so I was still in my training, and they used a laser, and they just do a cut, and then it just like started unraveling. She actually used the Q-tip for part of the release because it just like started
Just,
to open up.
I
Yeah,
assume you're
it's pretty
like
cool.
numb, right? Like you
Yep.
don't feel it. Yeah.
So yeah, there's nothing just like if you were going to the dentist for a tooth extraction or whatever. But yeah, you've been numbed and then
Whoa.
released. And I honestly didn't even know it was getting released until, well, I could smell some like tissue burning kind of. People probably don't want to hear that. But then my whole body just kind of like relaxed. My shoulders were like, there wasn't as much tension. Obviously, not everybody gets these outcomes. So I want to reference that. Like,
Yeah.
if you get a temporary release, not everyone gets this. It's a slow procedure, so your body has time to adapt because it's been holding onto this tension and this tissue. That's how it's been kind of compensating, right? It knows
Yeah.
your body knows this and it's holding on to it. So if you release it too fast, sometimes people just get
Yeah, you
overwhelmed. But
rebound almost, right? Yeah, yeah,
yeah,
yeah, totally. Whoa. Okay, this is so fascinating. And I mean, everything you've described is like dinging in my brain telling me to get an assessment, so I will keep that in the bank. So how have you integrated this like into your business? Because obviously this is like kind of a unique niche. It's so fast. I mean, the tongue is a massive muscle, right? Like we work on literally every other muscle in the body, and yet like this is such a huge one that relates to like everything we do, eat, sleep, talk, breathe, everything. Like it's such a huge, huge part of everything we do on a daily basis. So, yeah, wild. I like how crazy that we don't think about the tongue as like this muscle that needs physio and therapy, right? Like it's so essential. So I'm curious like how you've been marketing it or like how you've been I assume you probably have a relationship like with that dentist who's maybe giving you referrals. Like what does the marketing or like patient awareness look like for you in building that aspect of your business?
So yeah, right now I have reached out. There's a few dentists that I'm working with locally,
Mm.
and it's actually on my to-do list. So thanks for the reminder. Is to reach out to some of the orthodontists in the area and just like getting the word out. So typically, myofunctional therapists are dental hygienists,
Mm. 'Kay.
and that's kind of what people see. So some dental clinics in the area have a myofunctional therapist, which is a
Mm.
dental hygienist. But what
Got
we're
it.
finding is dental hygienists aren't covered by insurance companies, so people aren't getting coverage for it, and that
Oh.
is a huge barrier for people to get treatment.
Right, so they're covered for, like, cleanings, but they're not covered for the rehab portion of that, like, appointment.
Correct. Yeah.
Got it. Classic. Classic. My thoughts and feelings about coverages and insurance have been well documented on this podcast.
We don't need to
Uh,
open that one up.
yeah, yeah, totally. But because we are obviously rehab specialists, this is within our scope. So that's really cool. So you're able to actually like create the relationship and offer that component from more of a rehab perspective. That's like really cool.
Yeah, there's actually a training I'm just in the process of taking. Some people might have heard of the postural restoration. There's another one that does similar. It's called Applied Integration Academy, and that's the course I'm taking. It's called Gait and Grounding, and
Mhm.
it's looking at our body from a whole. So like, if our body we're not just tongues, we're not just hamstrings, we're not just quads, right? We're a full body, we're all connected. And I'm
Yeah.
doing this course right now, how it's gonna integrate so we can ground ourself body better in our body,
Mm,
and that's gonna help us in prevention of injuries.
and
A little
integrate the
shout
work
out,
into the
though.
whole. Yeah. Yeah.
Yeah, a little shout out. So, typically, the courses for gait and grounding are in the States. So California, Texas, it's great to
Yeah.
travel there, but we actually have one coming to Kelowna on
Mm,
the end of May, the 29th and 30th, the Saturday, Sunday.
yeah.
So anybody that doesn't want to have to travel, you can come to Kelowna and get the hands on. So
That's awesome. It's so nice when you see, like, big companies or big groups, big education courses come to Canada. It's so nice.
it's
It's
actually
so
the first
nice.
one in Canada, so that's kind of exciting.
Oh, amazing. So you've done like, you've done this incredible training and now you're yeah, you've reached out to the people who would refer to you. Like, are you finding it's building, like, your myofunctional therapy aspect of your business is building? Like, how is that working? Like, how are you finding you're primarily getting patients for it?
Yeah, typically it's from the dentist office for orthodontics, just because they're doing the education, right? So
Yeah.
it's unfortunately not everyone knows about it, even though it's been around for 15 years roughly. Um,
Yeah.
some people might disagree with that. It's been around a lot longer, but I'm not going to get into that right now. Yeah, so typically people are coming and saying like, "Hey, I've done Invisalign. It relapsed. Why did it relapse?" And then the dentist
Mm.
is having that conversation of, "Well, we swallow. I think it's 30,000 times a day. It's like a big number. So every time you're
Oh,
swallowing, and if you have an incorrect swallow, if you're it's called
yeah.
a tongue breath swallow. So that's when your tongue actually goes forward before you go back to swallow. So it's pushing your teeth forward, which is affecting your bite.
I'm trying to swallow right now without doing that. I don't think I can.
Yeah.
Oh my gosh. Whoa, I'm learning
So that's one
so
of the
much.
yeah, and so that's one of the times it opens up for conversation and then they say, okay, go see a myofunctional therapist. And kind of just like physio, people it takes a long time. We're retraining the body, right? You've had this habit for 30, 40, 50 years, however old you are, right? You've been breathing and swallowing in this way. So we're not going to fix it overnight. So
Yeah, yeah.
typically it takes you need what, a year, 18 months, 2 years to get like fully through the program. So I think I need to
Wow.
practice that. Like people, it's not a quick fix. You're going to have to be in it for the long haul and you're going to have to do your exercises daily. And we typically have like minutes of exercise in the morning and the night.
Yeah.
So you have to learn how to schedule it
Every
into your
day.
day, right? Yeah.
Yeah, yeah, exactly. As we do with our typical rehab exercises, right? This is no different.
Mhm.
So I guess, yeah, like in your business, what percentage of myofunctional therapy is your week right now? Like what's your client spread between long-term care, home visits and then myofunctional?
Yeah, I definitely need to put more time into marketing. So I had one mile client this week.
Mhm.
I had, I think, 4 final visit clients, and then
Yeah.
the rest of the time was long-term care.
Yeah, so you're shifting, and do you want to continue doing like, is that like I'm assuming you wanna be doing more myofunctional. Are you wanting to transition to that alone, or do you like kinda having the balance? How does that like yeah, do you like having the niche or the balance? Like, yeah, like, what does that look like for you in terms of spread?
You just put me in the hot seat, hey? Um, actually, I've been bouncing around with this, so I really love home visits, and I really love giving those people independence back. I
Yeah,
also really love my own. So
yeah,
for right now, I think I'm just gonna keep it how it is, but we'll see
yeah,
whatever happens, happens. Like, if I get to do
totally.
mile all the time, that's what's meant to happen. I don't really have an answer for that because I I love both of them.
Yeah, yeah. Oh, that's awesome, and, like, it's really great that you've been able to, like, build the Myo side of it while also having, something that's like a little bit less niche, right? So you have more opportunity for bringing in clients when it comes to home visits or long-term care. Like you said, having something a little bit more stable while you build out this one that's like a little bit more niche, a little more specific, less known, right? So that's a really I think that's really cool the way you gain some stability, which like I mean running a business is never stable. We can talk about that, but but stepping into a space where it is more niche, it is more unique, it's not as well known, having that the home visit component where you've had years of experience doing it, you have this long-term care contract, like I think you did a really interesting thing, like a really awesome way of like, yeah, finding balance, stability while you build out this other component of it. So, yeah, I guess what I'm really trying to ask is like, what's working well? Like, what do you find is working really well, and what are some of the like the goals or the objectives you're trying to reach? Yeah, like what's really working well within your business right now at the moment, and what shifts are you working towards?
Well, one of the big things, I'm sure lots of business owners can talk about this, but boundaries are hard to hold. So especially when you have your own business. Oh, I really need to email that client back, emailing people at 9, 10 o'clock at night because especially for me, it's like, okay, the kids have gone to bed. Now
Yeah,
I'm going to work for a day. So
yeah,
having that boundary of like, yeah, some weeks I do work 50, 60 hours, like, and I have little kids. So trying to figure that all out. And I am very fortunate that my husband, I call him my brother now. So it's like, okay, you're getting way too focused on work and like you need to pull that and you need to have more family time. So
mhm,
he's definitely a huge help with that. Um yeah, so boundaries are hard. Just like you just want to
yeah.
help people and like you kind of sometimes maybe give more than you should.
Yeah, totally. And how much time are you putting into admin right now? Like, because that's, I mean, that's the hardest part of it. Like, especially when you're solo, you don't have an administrator. You're in the weeds of your emails and phone calls and follow ups and reports and exercise programs. Like, there's so much administration that comes with this job. How are you managing? I mean, obviously, it fits into the nooks and crannies of your day. Like, you're doing it in the evening after the kids go to bed. Um, yeah, like, what does that look like? Like, how much admin are you doing, and what systems have you put into place to maybe ease that a bit?
Yeah, I actually haven't put any systems in, but I'm getting lots of notifications through social media, like check this out. So I haven't looked into those, but I probably should because just with my client population, typically it's a phone call to book an
Yeah.
appointment, right? And if you're in a in a session with a client, like I'm not answering my phone, right? I've dedicated this time to that client. So they leave a voicemail, then I'm calling back to schedule a time. I do have online booking, so the people that find me and book online, that's great. And then
Mhm.
I can give that phone call when I have the time to follow up if I need anything for that home visit.
Yeah. So phone calls is a
As
lot of
for like,
your yeah.
yeah, ideally I prefer email just because I can send an email at 10 o'clock at night. I can't call people at 10 o'clock at night.
Yeah. I'm the exact same way. In fact, I have a strong, like, personal policy is, like, I book everything via email because it's A, so much more organized in my inbox, and B, like, I don't like chasing people down, like, phoning people and having to chase them down. But that said, the population is different, right? Like, when you're working with perhaps an elderly group who's at home, who isn't so tech savvy, like, you do kinda have to have that as an option. So I think, like, our populations are a little different. Um but yeah, for me, like I same thing, like I can batch my emails, right? Like I can do a bunch in the morning, do a bunch in the afternoon, and then, next day, whereas phone calls, like I've always historically just been someone who's doesn't really like making phone calls. I will email over phone call every time if I have the option. Um, whereas like my partner, he'll just pick up the phone and phone someone and I'm like, "Oh, that would have been an email for me."
It's the
But yeah,
opposite in your household.
yeah, yeah, exactly. Is it? Yeah, yeah, there you go. So, yeah, I find, like, that though, then you, like, get a voicemail and then you're waiting back and so you're still kind of, like, chasing people down, but, yeah, it's admin takes up a lot of time. Like, were you surprised at how much admin there was? Or, like, do you find there's too much admin because of the boundary issue? Or, like, yeah, how does that present for you?
That's a good question. I feel like I was pretty well aware. I haven't honestly tracked it, like how many hours a week or how many hours a day. So maybe I don't have a good representation of how much time I'm spending because it's like
Mhm.
5 minutes here, 10 minutes here, right? Like
Yeah.
from the day, is that 1 hours, 2 hour, 1 hour, 2 hours? I don't actually know. So
Yeah.
maybe I need
Yeah.
to get back to you on that one. But yeah, it does take time, and I use Jane, so
Yeah.
people that do online payments, then I can do the receipt, like, that's really quick and easy.
Yeah.
I haven't started to use AI for charting, which
Yeah.
is something that I'm also going to look into, but
Yeah.
sometimes with this my population, like, they just don't feel comfortable with technology, so respecting their boundaries, especially when I'm in that house.
Yeah, absolutely. Yeah, what do some of the boundaries that you've had to establish look like? Like, what are some examples of boundaries that you've had to put into place?
I haven't had any issues, so far, like, clients are well
Yeah.
aware, like, this is a professional relationship.
Yeah.
I do have a story though from when I was working in Australia that I had a client who loved to share their carrots, like their garden. They just love their garden. And they showed up and they're like, I picked these carrots for you. And I was like, oh, like that's really kind. And then I showed up the next appointment and they're like, I picked these turnips for you. And I was like, okay, like this is lovely. You're very
Oh.
kind and your garden is beautiful, but like please stop doing this. You're making
Oh.
me feel uncomfortable. Like uh, I love providing physiotherapy for you, but like, please stop paying me. Like
Yeah,
in
right.
fruits and vegetables from your garden. They're beautiful, and I appreciate your garden, and I love gardening. But please keep these for yourself.
Oh, oh my gosh, right, and it's like, yeah, like yeah, like, yeah, we had a conversation, you and I recently about gifts in the relationship, and yeah, like, it's like, is there gonna be this expectation that comes with it that now they get different care, extra time, or, right? So it's like, yeah, that's a real hard one, and that's a hard boundary to establish, right? When they're so excited to share something with you, but at the same time, you're like, "I can't allow this to, like, affect the therapeutic relationship." Yeah, that's a tough boundary to set. That's a
Hmm.
challenge for sure. So how have you been able to juggle building this business, being a mother of 2 young children, being a wife, like, having how have you been able to balance all of this? Like, if anyone, I guess, like, to frame it in a way that is like, if anyone has a young family and is thinking about starting a business, what advice would you give them? How has that worked for you? And yeah, would you do it all over again?
100% I would do it all over again.
Yeah,
I never regret that I started my own business.
amazing.
Maybe some business owners on here like, well, you're still in the first year, so like just wait and see. But Just the freedom it's given me, and I
Yeah.
don't have to fit inside a policy, right? I can treat within my scope, but I can treat how I want, right? I can be there for my clients, and it gives me the
Mhm.
ability. One of the big things was sometimes people made appointments on the weekends or evenings, and then most clinics, well, kind of clinics are sometimes open on Saturdays or evenings,
Yeah.
but there's nobody that does home visits during those times.
Yeah.
So to be
Yeah.
able to support that part of the business as well, or the
And
population.
home visits are so unique in that you don't have to work a shift necessarily. Like, yeah, like you could have a super light Tuesday and then, yeah, do a couple on a Saturday, and then the following week have a really heavy Tuesday and then, take 3 days off, and, like, you have full control over that versus, like, being in a clinic, you generally have a shift. So, yeah, I think mobile physio opens up so much, freedom, control over your schedule, flexibility. It's such a unique opportunity within all of that. Yeah, like, I mean, obviously, that's a huge component of it, but are there any other, like, who would be best suited to running a mobile business? Or, like, what are the other draws of a mobile business?
For me, it's the people that listen, how do I say this? I think mobile physio is for those people that really wanna make those strong connections because it's personalized. You're in somebody's home, like,
Yeah.
and they wanna spend that time to get to know you. So it's not like, "Okay, you're here for a shoulder. Let's do an assessment. Let's give you some exercises. See you later." Like, I typically spend 60 minutes on my follow-up sessions with clients because you're in their space, you have to give them time. They wanna tell their story. They wanna be heard. They want like, this is all part of the treatment. They need that time to be heard and be appreciated and explain what they need to explain to you. So people that really want to, I guess it's the clients that are the physios that want to get to know their clients on a deeper level. So
Mm,
we know people aren't just a shoulder, they're a whole person and really getting to hear that story and letting them tell you, oh yeah, my grandson had hockey, they won the hockey game. Like they want to
here's
tell
the
you about their
picture.
life.
Yeah,
Yeah,
totally.
exactly. I guess a bit more
That's
intimate.
Yeah, and personalized, it sounds like, and, like, there's such a cool part of seeing someone in their own environment, right? Like, seeing someone in the safety of their own home or the comfort of their own home, I think can really open up, like, so much more in that therapeutic relation. Like, you can just see so much more of that person. Yeah, you're right, seeing them more whole and as a total human and not a shoulder.
And letting them kinda, like, be in control within reason, like, it's their home, it's their space. You're welcomed into their space. They're not in your clinic, so letting
Yeah.
them have, like, more control and flow of it. So, I
Yeah.
guess you just need to be able to go with the flow, even though I said
Yeah.
earlier that I like schedule, but you have to be comfortable with whatever's gonna happen. Obviously, I do my own safety checks before, and I usually expect a safe environment for me, but
Yeah.
like, there might be a dog that runs out midway through our section, or who knows, right? You don't know what you're gonna see or find, and maybe some of the houses aren't as clean as you would like, so you have to be okay with that.
Yeah. What are some of the biggest challenges with mobile work? I mean, obviously scheduling, I'd imagine is challenging. Are there any other I mean, safety is a big one. Yeah, and I'd like to kind of hear your thoughts on making sure you're safe while doing it. But yeah, what other challenges exist in the mobile world? Because obviously there's benefits that we've just talked about and it's flexible and whatnot. But yes, what are some of the other more challenging aspects of it?
People might see it as a challenge, but actually, I like the challenge of we don't have, like, a planet that goes up and down. We don't have all these things that we can, like, adapt and make, like, perfect environments.
Yeah.
Okay, like, so, okay, we're gonna do some standing practice at your kitchen. I'm gonna move something else that's stable for more support. Like, you kinda just have to
Be
figure it out and see
creative.
what's in your
Yeah.
environment. Yeah, and you gotta be creative, which I really enjoy, but maybe stresses other people out.
Yeah, oh, that's really cool. Tell me about safety, because yeah, you've obviously had a really scary incident. What checks and balances do you put into place to make sure you are safe when you're doing mobile visits?
Yeah, so part of my intake form is I ask about animals, I ask about
Mm,
whenever I ask about needles. And it's about smoking more because if I go into a home where they're smoking, do I smell like smoke before, like, I schedule accordingly. So those would be the
Mm,
clients that I wouldn't go and see another client right after because
right.
the smoke on my clothes might affect another client. So um, I put these checks and boxes in, and my husband, he I'm like, hey, I'm going to my home visit, and then I'm checking after. So
Yeah. So you have someone to
like,
check
for
in
privacy
with.
reasons, I can't really have, like, a stalker per se, right? Like, I always
Yeah.
check in with him, and he knows, like, and once I get to know people, like, I feel comfortable in their environments. And then just
Yeah.
if I don't feel safe, I'm going to leave. Like, at the end of
Yeah.
the day, it's about my safety and nothing. I love helping people, but I have to keep myself safe.
Absolutely. Absolutely. Do you ever like think about your positioning? Like, are you like, do you have yourself closer to the door or do you like, is there like kind of things that you're doing within the session for it too?
Yeah, I've been fortunate. I haven't actually had a situation where, like, you kinda get a feel for it when you come into it, right? But
Yeah.
I haven't had a situation that was alarming yet. I
Hmm.
probably will, like, let's
Yep.
just be realistic, that's part of the job. I've done lots of I keep in mind little things I do with public health, right? When I work there, it's like, what are your deficits?
Yeah.
What's your plan? Like, you kinda just run through those things, and it naturally happens, so I do it
Yeah.
naturally, but, like, I don't have a checklist per se that I go through, it
Yeah.
just naturally happens at this point. Um, I remember though, like when I worked in a public system, I had a few interesting, like, you think it's only you and the spouse in the room, and then all of a sudden someone pops up behind the I remember this one, somebody was laying in this bed that was in the living room,
Yeah.
and it just looked like an unmade bed, but okay. And I was like, okay, we're talking, and yeah, it's just us, whatever. And then all of a sudden, halfway through the session, this person popped out of the bed, and I was like, "Whoa, okay, I had no idea you were there, and nobody really said you were there." Like, yeah, like, so things like that used to happen all the time. So maybe it doesn't surprise me anymore. I don't know.
Yeah, you've had clearly like tons of experience and I know there's lots of training that comes with like your point of care assessments and all those things that come with, working with the public system. They do offer quite a bit of training. So you've obviously been able to translate lots of that into your business now. So yeah, it's interesting because it's something like I've always thought about doing home visits. Like what are some, guardrails you can put in to make sure things are really safe. And yeah, I mean, you're never guaranteed anything ever. I mean, someone could also come into the clinic and, harm, create harm. So it's goes in both directions for sure. But something that I always do is I do a telehealth assessment initially. So I always do the subjective piece via telehealth initially. So I book them in for like 45 minutes. Usually it's only half an hour, but I gather the subjective history via telehealth initially and I mean, with your population, it probably doesn't work as well because they might not be as tech savvy, but um, I find for me it's great because I can kind of get as much subjective history out of the way as we can so that when we do actually meet in person, we maximize our hands-on time. But it also is like my kind of like, let's see what the spidey senses are saying. Let's like get an idea and feel. And I find it's like a really valuable way of starting that because we kind of like, I'm not just walking into a house and being like, who am I treating? Like, like I find that that's been really helpful for me in that aspect. Um, but yeah, I mean, everyone's different. And then, tech being an issue within all that too is a huge part of that. So many factors to consider.
I'm just thinking about privacy, right? Like,
Yeah.
people have said, like, "Oh, why don't you just like share your location with your husband or like your friends?" And like, but that's private information. Well,
Yeah.
right? Like, we're going into people's private place. That's a breach of confidentiality. So.
Exactly, right? Yeah, it would be super simple to share that, but now we're broadcasting someone's home address.
Mhm.
That's huge. Yeah, oh my gosh, and, like, so many things to think about with technology and, like, yeah, there's a lot. There's absolutely, like, so many things, and you've clearly thought through, like, many of them. So, congrats. I mean, you're coming up on 1 year now. Congratulations. You've clearly built something very unique, very exciting, and well needed, like in different aspects, the home visits, the myofunctional therapy. Is there anything you would say to someone thinking about opening a business or, like like in the public system, even who wants to transition to the private system or starting their own business. Yeah. What advice would you give them?
Yeah, I guess I didn't even answer your question before when you said, like, any advice for people with little kids. It's gonna be hard, like, I think everybody that comes on your podcast says that. There's gonna be ups and downs, but as long as the ups outweigh the downs, I think you're winning.
And
And if I would have the opportunity to take your business of physio before I started the process, that would have really
mm,
set me up and I would have known a lot more
mm,
because like funding models, direct billing, all of these things were new to me. I never had to deal with it in the public system.
right.
So if you're not working in the private sector, like get all this information before so you can make these educated decisions. Like myself, I was, oh, if I need to direct bill if I'm going to get clients and this is what I have to do. And then I actually listened to your podcast episode about it. And I was like, oh, wait, let's pause. Let's think about this. Does
Yeah.
this really align with what I want? And I've actually decided not to direct bill.
Wow.
And that's also kind of going back to the admin costs. Like to have to track all that, that's just way more admin than I'm willing
Yeah.
to do right now. Keeping up track of like what's covered, what's not covered, tracking the money coming in, making sure it's the right amount. That's just more time on admin. I don't really think it's necessary right now. If I had a team and I have an admin, maybe I'll look into it. But right now, it's not a priority for me.
Yeah. And I think, like, yeah, I think, to kind of reiterate what you're saying is like being boundaried, being confident in your decisions and making decisions that like lighten the load in areas where you can so that you can spend more time with your family, right? Like starting a business is hard, but it's also hard to stay in work in a system where maybe you're not happy or it's, you feel like you're banging your head against the wall trying to make change or, whatever. Like you kinda have to pick your heart, right? And so, for me, like you, I will choose, entrepreneurship and figuring it out every day of the week over, staying in a stable system that, like, maybe doesn't fuel me in a way that entrepreneurship does. So I get that. And, like, the emotional, like, mental toll of staying in that scenario for me is way harder than the emotional, mental, like, administrative toll of, like, figuring it out and creativity and like finding balance and boundaries, right? So it's like it is pick your hard. But in your case, you've clearly found a hard, quote unquote, that works better for you.
Yeah. And like, I know that it's rare that at 4 o'clock that I'm done for the day. Right.
Yeah.
So typically my kids get picked up from daycare around 4 and I'll spend until bedtime with them. But
Yeah.
I know I'm gonna have to work after. So just being okay with that. Like you are not working 8-hour days. Maybe some days are lighter and you get more downtime or yeah, it's gonna be really fluid, I guess is what I'm trying to say. But then
Yeah.
also because it's flexible, you can take your kids for those outings or those appointments for your kids are not as
Yeah.
stressful. You don't have to ask for time off. You can just block it off in your schedule. So your
Oh,
days are a bit more fluid, but then you get more flexibility with that. So yeah.
you are speaking my language. That's what I value.
And I guess my big tip for people, especially if you have little kids, is if you have a spouse, like have that conversation before and like really be on the same page. So going into this, I know myself, I can get buried in work and just like down a rabbit hole and kind of put my blinders on. So me and my husband had that conversation before, and I'm like, you need to be my guardrail. We call it my guardrail because he is my chef. He is like, okay, you're getting really like focused. Like you need to step back and take some time for your family. And that
Yeah.
sometimes for yourself, it's hard to do that because you're just like blinded on. You just you're in it.
Yeah.
So for some, and not to be offended when people say that, be like, oh, thanks. Like I appreciate you checking on that.
Yeah, right, yeah, it is easy to be like, but I just need to do this, or I just need to," and, like, as physios, we're generally, like, highly empathetic people who go above and beyond for our patients, so it is so easy to get sucked down a rabbit hole or get stuck in the minutia of the work and whatnot, and the work is always gonna be there. I have to remind myself of that too, because I always wanna get on top of my checklist, my to-do list, and have it all done and checked and totally, like, wrapped in a nice little bow, only to then add 6 more things to it the next day. Like, it's always gonna be there. The work will always be there, and you're right, you have to, like, be present and having this ability and flexibility to spend time with your kids when you're able to and pick and choose is like, I think that is like the ultimate, that's wealth to me.
Yeah, and having that conversation and with your partner if you have one and being on the same page. Like there might be weeks that they have to do more of the
Yeah.
family lifting, but then there'll be weeks where you're doing more. So it's always going to be a balance. And yeah, just literally having that conversation, being on the same page before you take the jump.
Yeah, exactly. Good communication, self-awareness, all these skills that, make us better leaders, better partners, better family members. Yeah, I agree. The last question that I ask every single guest is, which I mean, I feel like you've kind of already answered this, but to put a nice little bow on everything that you've shared today, is the last question is, what does a healthy business look like to you?
I've actually put a lot of thought in this and I've gone back and forth and back and forth. Yeah, I think I've already mentioned that I've listened to pretty much all your podcast episodes. So I've been like reflecting on this for a long time. And originally, I was going to say a healthy business is one where your staff show up engaged, ready to work, healthy, fully present. However, life happens. We're not always perfect. So my answer is going to be a healthy business is one that is connected with its community.
Mm,
So if you're out there, like, are you helping? Are you volunteering? Are you fundraising? Are you providing finance for the things in the community? Do you have strong referral systems? I think those are all healthy because if people know you exist, they're going to find you.
mhm. I love that. Yeah, community is so important. It's so important. It's so important from like a personal standpoint and family standpoint. It's so important from a business standpoint. Yeah, like how are we, being of service to the community and engagement relationship with our communities around us? That's like it's really what life is all about, isn't it?
It's something that I've really focused on. Like, yes, my business is young, but I want to like get my name out there and I want to support non for profits and I want people to know I exist and I'm here to help people. But like I also want to give back to my community. And I actually recently joined, it's called JCI, it's
Mm,
Junior Chamber International. I'm not
okay.
sure if you've heard of it. It's for people typically under 40. I think the age range might be um, a bit flexible, but there's one in Penticton, there's one in Kelowna. There's, I think, 6 in British Columbia.
Hmm.
And what we do is there's sometimes business owners or management role people that are on the team, and we do fundraising, we do activities, events, there's education. And I think that was a really cool way that I'm a one person business right now, and I can join this collective and we can make a positive impact in our community.
Mm. Oh, that's so cool. That's really cool. And you're connecting with other owners as well. So you have a
Yeah, it was a
place.
pretty cool.
Yeah. Oh my gosh, I love it. Melissa, how can people connect with you? How can they work with you? Yeah, where do you exist online that people can get in touch?
I have a website. It's live grow physio.ca.
Amazing.
And I have an Instagram, which is live and grow
Yeah.
physio. And then if you go onto the websites, you're going to find my phone number. So I
Yeah.
don't probably need to put it out here, but yeah, any way you want to connect. Um, I am on Facebook as well with Living Grow Physio. I will be honest, I have not been as good about keeping up with that, even though I should with my population. So yeah, it's just
Yeah.
trying to figure out where you're going to do everything. And
Right?
I'm
And
sure
we
you'll
can't do it
probably
all.
put my information in the show notes.
Yeah, absolutely. I will link it in there. Congratulations. And like you have done a lot in the last year. So congratulations. You've learned a lot. Your experience that precedes the business clearly has translated beautifully into what you're building. So lots of value today. I really appreciate your time and support of the podcast and everything. That's also like just so I really appreciate it. So thank you so much for your time today. Yeah, and I think we should do like in another year from now, like another 2.0 and see like how things have progressed and changed and what else you've learned in that time frame. So perhaps season 2 will include another follow-up.
And then I'll be reading back and I'll be like, "Ooh, actually scratch what I said a year ago."
Hey, we live and learn.
Any yeah, anybody that wants to reach out to me, I'm more than happy to discuss myofunctional therapy, in-home physio, and really anything. Like, if you want to connect, I'm more than happy.
Amazing. Amazing. Well, I will also include that there too. So thanks again, Melissa. Enjoy the rest of your Friday and we'll chat soon.
Awesome. Thanks so much, Candy. I appreciate it.
Thanks. That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.